This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Hello and welcome to HealthLink, a program connecting home, community, and healthcare. My name is Carol Merton, and I'm delighted to welcome as a guest today Sarah Milne. Sarah is a health promoter at Grey Bruce Public Health, and today she is here to talk to us about a variety of things, but most especially heat events, emergencies, and maybe a bit about the recent smoke events we've been having in our area as well. Sarah, thank you for joining us today.
Oh, thank you for having me, Carol. The timing is perfect.
So just for our viewing audience who may have not had the wonderful opportunity of seeing you before, you are with the health unit. Now, how long have you been with the health unit?
I started in 2008, Carol, and I have done maybe one or two shows with you. I think I did one with Dave Carr years ago, and that was in the area of falls prevention. So with our jobs, we kind of pick up a few different things along the way, and that was the past, I guess. So now I'm in sun safety and physical activity.
Excellent, excellent. So wonderful topic, and I'm wondering, thank you for sending the questions along to me, because that'll make sure I stay on track as we go through this. So today, first of all, we're going to talk about heat events. And I'm wondering if you can really describe, what do you mean by a heat event? Because what might be heat to one person may not be heat to another.
Yeah, and I think most people think of them as like a heat wave is really kind of the general term that people use. And it does vary in different jurisdictions on what is classified a heat wave or potential weather event. But with the health units, they are covered under their policies through their Ontario Public Health Standards. I just have to pull up my notes here to, and the organization that manages that is, it's called a Heat Warning and Information System. And this actually coordinates and oversees the process behind calling these heat alerts. And it's a group formed by the Environment and Climate Change, Health Canada, Ontario Ministry of Long-Term Health and Long-Term Care, and Public Health Ontario, in consultation with the health units. So they will issue alert based on temperatures that they've identified for the really only 3 regions in Canada, which is interesting. So there's a northern region, we're in the south region, and then there's the very south region. So our region is quite large. So when they do issue something for Grey and Bruce, our medical officer health would look at that and sort of determine how does that impact us locally? What are the weather events that are happening within our area? And it sort of falls into this 2 to 3 day, how long is this event going to last? What are the extremes and what are the low temperatures? And some other factors in that zone. I think during COVID, that certainly made things a little bit more intense.
So for me then, it isn't just watching the weather person on TV that makes a declaration. It really is an official declaration that comes through public health, correct?
Yeah, absolutely. Yeah. So the issue will come from the weather forecast, the environment, and then it gets interpreted by each individual health unit, and then they would then issue the alert through their communications department.
Now you mentioned climate change. So are you anticipating that we're going to be having more of these events? And I don't want to put you on the spot, but
I am not a weather forecaster, that's for sure. But I would say this is certainly the conversation that I have been reading about or having with other health units. And certainly during COVID, I was really connected in the communication world and sort of seeing what happens, just recent events between Western Canada and Eastern Canada and now Ontario. And 2021, there was a big, they called it the heat dome in British Columbia. So that's when I started watching a little bit more carefully some of the temperature and heat monitoring that happens in provinces in our area. And that event really spearheaded a big kind of aha moment, I think, for a lot of organizations of like, oh, this is really interesting. I don't have this stat specifically, but there were at least 400 deaths in British Columbia around that the heat dome event. So those are people who are more vulnerable to the heat.
Okay.
And there's all kinds of things that come into play there. Have people acclimatized? Is the event happening in June versus something that's happening in August when we've been smoking hot all summer long? And people who are on certain medications, have health issues, have chronic diseases, young children, older adults, all of those people are more vulnerable to these health impacts. So as we talk about climate change and we see the increase in the number of these events, we do think that, the advanced planning is a good idea. Preparing for heat events, whether they happen or not, and that's same with our pandemic responses, right? And the role of public health, and certainly with municipalities, is that emergency planning for these particular events. So it's a bit of a call out to organizations who perhaps work with older adults. I know recently I sent out policy guidelines and recommendations for sport organizations. And so that went to our municipal partners to say, hey, like, time to fine tune that pen and take a look at it. And surprisingly, it isn't a very common thing to see in policies. I think just before I went on here, I went and looked at the Board of Education policy, and they have an inclement weather policy. And that's pretty much it. So it really does leave it up to the individual schools, which is great. And again, thank you to COVID. There are some pluses there. A lot of our schools in Ontario and Canada, we are very fortunate, got air conditioning and increased HEPA filters and things like that. So we're fortunate that our schools are actually in a better spot than they have been in the past for even having a policy around heat. So I would like to see some more heat policy. It just creates awareness behind what's possible. And ultimately, you want to make sure the vulnerable people, those that are at higher risk, are taken care of. And during those times when it is challenging. In June, it's so early on in the season that I think it was 2 weeks ago, I think I sent out a note about like, hey, are we going to be looking at this? We always have our first June event and nobody's ready.
Yep. So you've mentioned vulnerable people, but how does a heat event actually impact someone's health? Well, you mentioned about the heat dome, but are there different ways that people's health can have an impact with a heat event?
Yeah, certainly. I think one of the big things I think is I think people just, part of it is just not being aware of their own self-awareness of where their temperature is at, especially children. They're running around. They don't have the experience that adults have in understanding like, oh, I'm feeling a little dizzy. I'm really hot. I'm flushed, or my urine's really dark. Like it doesn't, they don't have that experience. And I think for most people, just the heat initially comes as a discomfort, right? It's like, oh, I'm sticky. Oh, I'm hot. Our bodies are designed to accommodate heat and regulate that. And when it becomes a problem is when our bodies aren't able to do that efficiently or effectively. And what impacts that is the medications. It's our chronic diseases. It's our environment. It's, it does come down to the social determinants of health we often talk about. I know you're quite familiar with that, but that's our housing and our income and our access to food. And those would also have an impact on it. Access to clean water, access to cooling stations, or even air conditioning. And that comes back to somebody's income. So it's a weird kind of impact on somebody, but it really can just be uncomfortable. And then depending on what you're doing and what conditions you have, it can go into heat illness and heat stroke and mortality from there.
Yeah. So certainly anywhere from feeling a little bit dizzy to feeling sick to their stomach to could they pass out? Do they ever have to have hospitalization from, I've heard of heat stroke. Is that one of the impacts as well?
Yep, often, yeah. And so you'll see a variety and through part of the data and monitoring from a public health standpoint, would also be monitoring the incidents that are coming into hospitals. And you would see that, and certainly during this recent episode of air quality, more than likely you would have seen an increase in maybe emergency department visits, calls to doctors and physicians, healthcare providers, even prescriptions or medication pickups at pharmacy. So there's the other way of observing different things that might be happening to kind of say like, oh, what's going on here? But yeah, like all the things that you listed, urine is another great way. You know, if orange is not so good, there are food.
Tell me about urine.
Yeah, for urine's a great, well, everybody does it, right? And kids think it's funny, it's a great way to say, like, I mean, it's not super accurate, but I think it's a nice visual. It's kind of like somebody sweating. If people are sweating, you know they're hot, but when they stop sweating, sometimes that's an indication that they are overheated. So something like looking at urine, if they're getting sick, if they have as a nausea and vomiting, if they have headache, their rapid breathing, their heartbeat's high, like all kinds of different indicators from that.
Yeah. So I'm going to ask you about urine. Not that I'm going to.
Yeah.
Let's say I had orange colored urine and it's hot out. What would you say to me around that? Like that would be an alert. Is there something I need to do to be able to, obviously my body is doing something it wouldn't normally do. What should I do?
I think my first question, I just like to ask myself those questions of like, hey, that's interesting. What have I eaten today? Am I on so for some people, certain medications might cause that to happen. So they're dehydrated. Have I been super active? I know personally, I try to drink, I've got my water right here, right? I try to keep it handy and drink regularly. And I think when your urine's a different color, you should ask yourself some questions like, oh, have I drank enough water today? There's some people that only drink coffee or tea, and that is a form of liquid, but they can also be dehydrating. So they are a diuretic. They will force you to pee a lot more than maybe you need to. But taking a look at what you've been doing during that day.
Yeah. So certainly as the temperature warms up, it is important to think about keeping hydrated and make sure that you keep enough. And a change in color in urine could be just a signal that you need to have. Yeah.
And I feel like everybody looks at that. And I think that's something that doctors often look at, and old or young, it's a function of your body.
So you mentioned about public health issuing a health event notice. So in our area, trigger it? Is there a magic temperature, or is there, does it have to go over several days before what would trigger it in our particular area?
Yeah, well, again, I have to go back to the acronym. It's HWIS, so the heat warning and information system. There's no easy way to say it. HWIS, maybe? I don't know. And what they will do is they usually issue the warning 18 to 24 hours in advance of a heat event. So that triggers a series of probably emails, maybe phone calls to the different health units within the region. And that warning usually comes when it's expected to last at least 2 days. So this is where it gets kind of interesting, because you could say, oh my gosh, it's hot today, why haven't they issued a warning? But it really does look at, it has to last at least 2 days to kind of issue that warning. An extended heat warning, which is kind of that next one, is where it's longer than 3 or more days. And I don't know if we had one of those last year, but I know we've had them in the past, and it gets really hot. And what I've noticed is that, and I'm in a big old house, I'm okay for the first 2 days, and then the heat starts holding in it. It's no longer like, because older houses I find tend to like keep that coolness, especially in the lower levels. But once it's been 3 or 4 days, I feel the heat kind of moving in and settling in. And that's when I know, like, oh, this is an extended heat event.
Yeah. So preparing for those, because we are going to happen. What are some proactive things people can do? Let's say you don't have air conditioning in your home then. Let's say, for example, what should or could people do to help themselves?
Yeah, and certainly in those 2-day events, 3-day events, there's a few things that you can do. I think when you look at some longer ones, there are some different strategies to look at. But again, the events that happened out in British Columbia really helped form a lot of the policies and guidelines. And I think one of the first things that people think about is, if they have fans or air conditioning. Certainly having your windows open is better than not. Certainly because you just need that air circulation. You need the movement of that air to help cool things down. Yeah. You're looking at drinking lots of water, taking a break from the heat. So I always think about the people that are working outdoors. I don't know how roofers do it, honestly, but they are so tough. And that's the acclimatization, right? Like that's what they do, and they can handle it. But I think it's taking those breaks, taking cold showers, staying out of the sun, preparing meals that don't need to be cooked is a big one, or cooking outside. That makes a big difference. Even I was reading some stuff on kids, and it's, making frozen popsicles or freezing clothing and having that fun kind of engagement with kids where you can have fun with it. And even adults too, drinking cold water, making cool food, playing near the water. It's always nice as well. Yeah. And again, once the temperature goes on a longer period of time, there are different things to think about and what some of those risks are. But really, if it's hot and it's sunny, you're going to try and stay out of the sun as best you can. The shade is your friend. Air circulation is great, so fans. I think one of the issues that started happening out in BC was in apartment buildings, and the heat in those buildings just rose and rose. And sometimes low-income housing or people who don't have a lot of money can't afford fans and can't afford air conditioning. And so, and the heat rises in those buildings. So it's really important to look out for your neighbors, check in on them. People or property managers that have units or multiple floor units is to check in on those people. And, maybe even come up with there's cooling packs that you can come up with that might have, a water bottle in it, an ice pack in it, I don't know, a towel or something, like things to think about in case of a heat emergency that could be shared to people.
It's really interesting you talk about air circulation, because not everyone wants air conditioning, for one thing, or has it, but keeping the air moving helps to regulate to an extent the body temperature. And people may not always recognize that, just having a fan going in the bedroom or wherever you are is a helpful thing, even if the air isn't particularly cool. I've heard of people who even put containers of ice chips by a fan so it blows cool air at them. I don't know if that's a good thing, but
I don't know. I would be curious about that. I know I spent some time in southern states, and they call them swamp coolers. And it was basically a mesh box that had straw built around it. And you ran a hose and covered the straw with water during the heat, and it would basically blow this wet air on you. I don't know if it's like public health approved, but certainly what it was is that idea that it was moisture in the air flowing over you. And mind you, this was like desert temperatures, not supposed to be out and around, but it was the way to cool your house. So I would be curious to know about the ice chips in front of the fan, how it would work in our humid environment. I might try it. If you got ice chips, I'm probably going to eat them though. I'm not leaving them on the counter.
Yeah, I absolutely hear. But I've even heard of people who freeze a water bottle and just put it at their feet, and just to cool down their temperature.
Well, they make cooling vests actually for triathletes and high performance athletes. You can get a cooling vest that basically is, ice packs that sit around your body to reduce the temperature of your core. So all of those things are great.
Anything you can come up with. You referenced a little earlier the social determinants of health, and you also referenced the fact that people who live in poverty are disadvantaged by this and potentially more at risk. Is there a fund or ways people can donate to help to assist people who maybe don't have the money for fans, or do you know of any place where that kind of donation can occur? Whether it's fans for the summer heat or something else for the winter cool, when people are cold. Do you know of any place that people could make donations?
Oh, that's a great question. I would think a lot of charities do some of that work specifically. I always think, when I think of helping people, I always think of United Way. But I also think municipalities are very well connected. It may not be a charity per se, but they have housing facilities. They often know of where the rental units are in town. They know different income areas. Schools often know the children and family that are of lower income and may not have those opportunities to have a fan or get to the pool or even a vehicle, right? So they certainly think I think the best part is just asking those questions to the community and putting it out there. I know we have quite a few secondhand stores. I'm in Meaford, of course, and we've got one down the street, and you can donate items there, and those items there are more affordable than going to some of the bigger shops for people who can't afford those things. But it would be interesting to see, and I think when heat emergencies happening, and if it goes on for a prolonged time, it's up to the municipality to call an emergency event. And so in that sense, there is a different access to funding. And in that case, there may be opportunities for further donations or for even the town or municipality to access funds. I think communications, and one of the rural communities can be a bit challenging during heat events because of various reasons, but one of the best parts is that we tend to be a little bit smaller and we tend to know each other. We do have fairly good communication sort of within those smaller networks. Sometimes it's not great in the broader sense, but I think it's thinking about your neighbors and thinking about those people that may not have those opportunities, and communicating that you have something to give or to share, and of course doing what you can do, but within your own means and capacities.
For sure. And further along the area of those who are most disadvantaged, those who are unhoused, rely on cooling centers in many, many ways. Not all are open. I mean, when you talk about rural municipalities, not all are open 24/7, which creates a challenge of its own in being able to care for people. And certainly that's something, as we move further down the road with climate change, it's becoming a real issue. So let me ask you a question.
Yeah.
Parents or grandparents, so there's potentially one of their children or grandchildren are showing signs of things like a heat stroke or dehydration, whether it's during an identified heat event or they've been out playing in the heat.
They're just being kids, right?
No, I don't want to come in, I want to play. Can you offer some suggestions about what they should do, and how do they decide, okay, I need medical intervention versus what can I do just in time at home?
Those are great questions. I think prevention is always the best part of that. So choosing to participate in activities at not as hot time of the day. So looking at between 11 and 3, the UV index is the lowest. That's really kind of a good indication. But generally, I'm finding that most of our UV indexes are 8 and above anyway, so it's high. But trying to pick cooler times of the day to do your activities. So in the morning and at night. And if you are doing more strenuous activities, picking those times of the day, making sure you're hydrated, having cold towels with you, bringing your ice packs. And again, it is really about the prevention. Heat illnesses are preventable. And as we go through the summer, our bodies are going to acclimatize. So it really is this window of, spending some time in the warm weather to get used to it, not overexerting ourselves, and knowing kind of our limits. So if we get past those limits, having a parent or a grandparent there, making sure that they're okay, is just observing for, the red face, I find, is a great indicator. they're flushed looking, if they have noticed that they've been sweating and then they stop sweating, if they're not really making sense, if their behavior's off, that can be a really good indicator. Kids are a little bit different because they don't always respond the way adults do. But just changes in behavior is a really good one to notice, that you may find that they're just a little bit more fatigued or tired or cranky or like than usual.
Yeah.
And it all depends on where your kids are at.
For sure. But, you know, when in doubt, definitely the hydration again, pulling them out of wherever they are.
Yep. Put them in the air conditioned area, keeping them cool, encouraging them to drink water, being aware of how much. So sometimes you can give too much. So looking at their electrolyte balance, have they eaten regularly? And again, what kind of medications are they on? Did they miss some? Have they taken their medication? What are the interactions? There's a lot of medications that interact with sun and heat and change your physiological network of your body, and will have a big impact on your body's ability to handle that heat. And then, I was going to say, and then the standard, like using fans, your ice packs, immersion into cold water, like cooling that body as quickly as possible. Once you get, not that you can tell, but you should be able to see your children or your grandchild progress from, oh, they're just really sleepy, to like, oh, wow, like they are not moving at all. And if you feel them, they will feel hot and they will need to be cooled down.
So we have a couple of minutes left in the program. It's gone by so fast. I'm wondering if you could just talk a little bit about the smoke and obviously what's been happening because of the wildfires, and how people can protect themselves. I've noticed there's been, even on my vehicle, there's particulates that would not have been there. So what can you share about it?
I will try my best. I am not an expert in this area. I certainly think that there are people at the health unit, especially in the environment program. But I think for me, as a parent, I was really trying to balance, and having some issues with my lungs was really managing how often should I be outside, when should I be outside, and what should or could I be doing? I mean, if this is only a 2-3 day period, like, hey, like just take a break, practice some other low-key activities. I think for one of the main things that I did was because the heat wasn't there as well, again, that's you have to kind of put those little limits on there. I did close my windows in my house so that the air particles didn't come in there. So my house became kind of the safe spot. When I was driving my vehicle, I recirculated the air when I was driving in my vehicle. And if you have air conditioning, great. For those that don't, and you have your windows down, it can be a bit of a challenge because it does get quite warm. So you're kind of having to weigh a few things. When I was doing some other reading into it, I was, again, looking at some athletes and some policies around that. It talked about, if you're going walking or running, walking on, because the air pollution, the smoke is kind of like smog, right? So it's kind of like what you would experience in a city, those particles. And they talked about something simple as walking up the downside of a hill on a road. So let vehicles use less or create less exhaust when they're going downhill versus uphill. So just even that like little concept of, there's going to, And another one was, and if you're, we want to encourage physical activity and being active, is taking less vehicle heavy roads to work or to your play areas. So
and you know what? Those are helpful hints. Sarah, I can't believe our time is up.
Yeah, I can't believe I did it either. I can't believe I talked this long about it.
You got wonderful information. I want to thank you for being.
Call the Rogers TV viewer response line. Email us or connect with us on social media.
Hi, I'm David Sherman, host of Politically Speaking. Join me for my next show, where my guest will be Mayor Ian Boddy of the City of Owen Sound. Politically Speaking on Rogers TV.
6,423 missing threads.
One for every hate-fueled protest and social post.
From just the first